In the 60s and 70s, you didn't have a lot of what is today known as fat burners. A lot of they weren't available back then. The main actual supplements that were often touted to promote body fat loss was a combination of choline, which is kind of a semi-B complex vitamin, and inositol, which is also classified as kind of a semi-B complex vitamin, meaning that they're both not really vitamins, but they're often classified in the B complex group. But they were considered to be the fat-burning supplements that were used by bodybuilders in the 60s and 70s. Now, what was the reasoning behind that? Well, nobody really knew, but from a scientific point of view, choline actually does prevent the accumulation of fat in the liver. It's classified as a lipotrophic, is the scientific term, and it does that by contributing chemicals. Well, they're called methyl groups. Methyl groups allows the liver to kind of get rid of fat that otherwise might accumulate in the liver. So that's where the idea, because choline helps to kind of clear out fat stored in the liver, somehow that choline being an overall fat burner, it never really was. As far as inositol goes, that's even more. But inositol, now today we know that inositol is involved in glucose metabolism, also insulin metabolism. So in that respect, it's again kind of an indirect, I don't know if you'd want to call it fat burner, because that's a misnomer to begin with. Fat can only be burned in the presence of oxygen. You have to be doing a DNP, which I don't recommend. But most supplements that are touted as fat burners are actually more accurately called fat mobilizers. They promote the release of stored fat in lipocytes of fat cells. Fat is stored in the form of triglyceride. And when you take most fat burners, they stimulate enzymes like hormone-sensitive lipase, which causes the fat cells to break down its stored triglyceride into its components of 3 fatty acids attached to glycerol, and the fatty acids enter the blood, and if you do something to oxidize them, like exercise, then now you have fat burning. But the truth is that I hate to say this, but this is not gonna. A lot of people aren't gonna like that. But most of the commercial fat burners today, the active ingredient is actually caffeine. Caffeine does mobilize fat from fat cells. The other ingredients in most commercial fat burners really don't do much at all. I mean, they put them in there to justify the high price, but the most active ingredient, 9 out of 10 so-called fat burners, is actually caffeine. And you get the same thing by drinking coffee. Taking coffee or some other caffeine source a lot cheaper than wasting money on expensive and mostly useless fat burners. There were a couple of so-called fat burners in the past that really did help to burn or help to reduce body fat, let's say. One of them was ephedrine. Ephedrine was very effective. It did a number of things. It not only helped to mobilize stored fat, but it also promoted the conversion of the inactive thyroid hormone called T4 into the more active T3, and by doing that it helped to slightly raise your resting metabolism, but more importantly it helped to maintain thyroid function under dieting conditions, because when you reduce calories substantially, after a couple of weeks your body lowers its metabolic rate to accommodate the intake of fewer calories, and that's often called, the term for that is dieting plateau. And it's usually caused by changes in the way thyroid hormone is produced. The active thyroid hormone T3 is converted into a substance called reverse T3, which has no effect on metabolism, so your resting metabolism goes down. But I don't want to get into all that. I kind of veered off course here. I wanted to talk about one of the components of the original so-called fat burner, which is inositol. Inositol, you don't hear much about inositol these days, but it has a couple of attributes that weren't known back then when it was used as a so-called fat burner. For example, inositol. What is inositol? Inositol is actually a sugar. It structurally looks a lot like glucose, but it isn't. But it is a sugar, and it doesn't raise your blood sugar. In fact, it actually will help to lower it, which I'll talk about in a minute. But it is produced naturally in the body. One of the things it does, it reduces anxiety by affecting a brain neurotransmitter called serotonin. Serotonin affects mood and behavior, and they found that when you have certain anxiety disorders such as panic disorder and obsessive compulsive disorder and post-traumatic stress disorder, usually that involves lower serotonin levels. Most of your prescription antidepressant drugs work by increasing serotonin in the brain. They do that by preventing the reuptake of serotonin that would normally break it down. So it increases serotonin in the brain. There's been studies showing that supplemental inositol can reduce panic attacks in people that are prone to panic attacks. What is a panic attack? Panic attack, as the name implies, is this feeling of panic that comes out of nowhere, where you suddenly feel like really scared is the only way. Your heart rate goes up. Some cases you can even get you can get a panic attack from a slight heart rhythm disturbance. A heart rhythm disturbance can convert into a panic attack. It's kind of a signal to your brain that there's something wrong. And it turns out inositol in larger doses, something like 12 grams, has been shown to be effective, very effective in controlling panic. Well, actually, even larger than that, 18 grams. There's a study of 20 people had panic attacks. They gave them 18 grams of inositol a day. It reduced the number of panic attacks by 4, which doesn't sound like much, but when they gave him anxiety medication, prescription anxiety medication, it only reduced the panic attacks by 2.4. So inositol in this instance was better than prescription drugs at treating panic attacks. A study in people had obsessive compulsive disorder. What is obsessive compulsive disorder? That's like doing something over and over again for no particular reason. For example, like these people will wash their hands like 50 times a day over and over again. Or people will repeat things. They feel like they have to say things. They're obsessed with doing things. That's obsessive compulsive disorder. Again, another study showed that providing a large amount of inositol, 18 grams, improved the symptoms of OCD better than a placebo. Other studies show it wasn't that effective, but look at it this way. Inositol, unlike prescription drugs used to control these mental disorders, prescription drugs always, absolutely always, can produce side effects. There's an axiom in pharmacology: if a drug doesn't produce side effects, it doesn't work. Any pharmacologist will tell you that. That's the way it works. Now, as far as getting back to that fat burning situation with inositol, inositol probably was considered a fat burner because it increases insulin sensitivity. When you increase insulin sensitivity, your body secretes less insulin when you eat carbohydrates. And insulin, the problem with insulin is that it's the main fat storage hormone. When you take in too much carbohydrates or too many calories, insulin promotes the storage of the excess calories as fat in fat cells. In addition, when insulin is high in the blood, like hyperinsulinemia, insulin turns off all the mechanisms in the body that are used to reduce body fat. So you always want to control insulin. Insulin resistance is also called prediabetes because it's considered the precursor for diabetes. People with insulin insensitivity, again, as the name implies, they become less sensitive to insulin, and what happens is they tend to have higher blood glucose levels, which is dangerous in itself. I've had little debates with doctors. I have a little bit of insulin insensitivity myself. I'm pre-diabetic. In my case, it's a strong genetic factor. My father died of diabetic complications. Both my grandfathers had diabetes. definitely have genes for diabetes. Didn't notice any blood glucose problems until I was over 50 years old. But I keep my blood glucose in check by exercise and diet. I can't eat refined carbohydrates. I don't want to talk about myself too much. I tend to get off track. Excuse me. But anyway, insulin resistance is bad. Insulin resistance is defined as having a resting blood glucose between 100 over 100. But when you get to 126 resting blood glucose, that's full-blown diabetes. So people with insulin insensitivity typically have resting blood glucoses of about anywhere from, let's say, 105 to maybe 117. And that's typical for insulin resistance. A lot of doctors, I don't know why they say this. It really annoys the hell out of me. I mean, if you tell them that you have a resting blood glucose of 115 or 117 consistently, that's fine. There's nothing wrong with that. You're doing fine. In other words, they consider as long as it's below 126, you're fine. That's bullshit. Bullshit. Having a consistently high blood glucose over 100, that's what I'm talking about, they've shown a 12 times greater risk of cardiovascular disease and about a 6 times greater risk of dementia. So again, having elevated blood glucose above 100 is not benign, no matter what these stupid doctors say. Some of the dumbest shit, even though they went through med school. But anyway, inositol affects insulin because it acts as a signaling factor, and it's used to produce molecules that are involved in insulin's action in cells. It's been shown to improve insulin sensitivity. A 6-month study of 80 older women who had metabolic syndrome. Metabolic syndrome is a constellation of symptoms such as having a wider waist circumference, higher resting blood glucose, higher blood triglycerides, and what's the other one? And high blood pressure, that are basically is a portent to having diabetes and cardiovascular disease. It's called the metabolic syndrome. A 6-month study of 80 older women who had metabolic syndrome found that when they took 4 grams a day of inositol, it improved insulin sensitivity, lowered blood pressure, and it lowered cholesterol more than a placebo. Also, women with a disease called polycystic ovarian syndrome, which is marked by numerous cysts on the ovary. Among other effects of polycystic ovary syndrome, a lot of these women get what they call hirsutism. With PCOS, or polycystic ovary syndrome, women tend to produce more of the precursors for testosterone. Most of a woman's testosterone is produced in her ovaries through certain precursors, such as androstenedione. When you have polycystic ovarian syndrome, your body produces more of these testosterone precursors, and as a consequence, these women have higher testosterone who have this disease, and they start to get like hair on their face. They get symptoms of having higher testosterone. But when you give women who also have women who have polycystic ovarian syndrome also have problems with insulin sensitivity, and when they give these women inositol, it seems to improve the insulin sensitivity. As far as the testosterone goes, that's treated by other means that I'm not going to talk about right now. But anyway, another problem with this PCOS, or polycystic ovarian syndrome, is that it tends to cause infertility. That's one of the main problems. And so inositol, by helping to increase insulin sensitivity in women PCOS, it decreases the risk of infertility. The doses they've used for this particular condition are 2 to 4 grams a day, and it works for normal weight, overweight, and women who are fat, or I should say obese. What about depression? Inositol is known to help decrease in depression. As I mentioned earlier, serotonin is a brain neurotransmitter that, when produced in lower amounts, tends to produce depression. And as I said before, inositol tends to increase serotonin. In that respect, it'll help to decrease depression. There's research showing that ingesting 12 grams of inositol a day for a month reduced the symptoms of depression compared to a placebo. Another study found that providing 6 grams of inositol a day improved depression in 9 out of 11 participants. So, it helps with depression. As far as side effects, as I said earlier, inositol is found naturally in a lot of foods. It's produced in the body. It's it's non-toxic. Some studies, as soon as you go to really high amounts, such as let's say over 12 grams a day, some mild side effects may become apparent, like stomach pain, upset stomach, and flatulence. But all you have to do is reduce the dose, and you don't have any problems. There's a couple of other things. Inositol may help reduce cholesterol, as I said. It might help produce, lower blood pressure. There's most inositol supplements come in the form. It's called myo-inositol. Almost all the inositol that's produced in your body is myo-inositol. 90% of the inositol content of your cells is myo-inositol. There is another form called chiro, C-H-I-R-O, chiro-inositol. Now, chiro-inositol is found in far less amounts compared to myo. It is available in supplement form. There's been a lot of claims for it, but what it seems to do, it's a little bit more effective than myo-inositol at promoting better use of glucose and also stimulation of glycogen synthesis in the body. That's the main difference. Again, inositol is a carbohydrate, but it doesn't affect. If it does anything, it'll help to lower blood glucose levels. As a side note, I saw a video by a certain individual who claims that inositol can be used if, for example, you're sleeping and you wake up, like in the middle of the night. Some people will wake up in the middle of the night, find it difficult to go back to sleep. He suggested ingesting inositol, which will help you fall back asleep faster. Unfortunately, I don't know where he came up with that idea. I've not been able to find any research. He never gave any reference to show proof that taking inositol helps you fall back asleep. However, there's some evidence that inositol does help promote sleep. When used, again, larger amounts, you have to take about at least 6 grams of inositol will help promote sleep. What else can I say about inositol, really? I think that's about it. I keep a bottle of inositol on hand. I added it a couple of months ago to my sleep regime. I take a number of herbs to fall asleep, such as I take valerian, I take, I can't even remember. I take passion fruit, I take theanine, I take melatonin, I take this certain Japanese herb, which I won't even try and pronounce. I take all of them, and I also take taurine powder, about 4 grams or 5 grams of taurine. And in addition to that, I take about 5 or 6 grams of glycine, which also helps you sleep. I take all of these at once, taking about an hour before I fall asleep. I added inositol to the regime, because it's, again, I came across a couple of studies showing that inositol helps sleep too. I probably don't need it, but I keep it around anyway. So, again, if you want to use inositol, I think I gave most of the dosages. The supplemental range is anywhere from 2 to 12 grams a day. So that's about it for inositol. If you want more information about nutrition, exercise science, anti-aging research, ergogenic aids, hormonal therapy, what else? Supplement science. Which supplements work, which ones don't. I'm not associated with any supplement company. I'm not going to try and sell you any supplements. But there are some supplements are definitely better than others, and a lot of them don't do a damn thing. But I'll tell you all about that in my Applied Metabolics publication. I also cover women's health and fitness. I don't neglect women. I have plenty of stuff in there for women. And quite frankly, most of what I write in Applied Metabolics is equally applicable to men and women, but there are some differences in using certain, let's say, supplements and certain exercise techniques that women might have to do things a little bit differently, which I do explain in Applied Metabolics. So it's about 30 to 40 to 45 pages each month. Comes out on the first of the month. It has no advertisements. What's interesting about Applied Metabolics is a lot of these other digital publications that focus on nutrition or exercise have anywhere from 5 to as many as almost 30 people working on the staff. Applied Metabolics has one, me. That's it. I do all the writing, I do all the research, and all the editing. It's just me. Now, you might say, well, aren't you at a disadvantage? No, and I'll tell you why. Because unlike all of these other digital publications, none of them, not one of them, has any professional writers on their staff. I am a professional writer. I've been writing professionally for over 50 years. I know how to write for the public. And believe me, it makes a big difference in the conveyance of information that's understandable when you know how to communicate with the public, which these people, apparently, judging by their writing, have never learned to do. I mean, they offer good information, although some of it's quite boring and of no practical value, I have to tell you. But, a lot of this stuff is evidence-based, but the presentation is very poor. I rate them on accuracy. I'd rate most of these other digital publications. I'd give them a B for accuracy. I'd give them an F for writing ability. Total failure. Trying to read those other digital publications is like wading in thick mud. And in addition, they're also anywhere from 3 to 50 times more expensive, and I'm not exaggerating, than Applied Metabolics. Applied Metabolics is now going into its 10th year of publication. I've never raised the subscription rate, even though everything around me has gone up in price. And I mean everything. The cost of producing it, the cost of the maintaining the website, everything has gone up, but I've kept it at a price that I believe everybody can afford. Anybody can afford. I don't care how broke you are. I don't care if you're not working. This publication, Applied Metabolics, it can literally save you life. It can save you countless amount of money, so you don't because you avoid getting ripped off, because you know what the truth is. I'm telling you, you got to subscribe. www.appliedmetabolics.com. You won't be sorry. Let me see, what else can I tell you? When you subscribe, send me an email and I'll send you an invitation to join my private Applied Metabolics Facebook page, where every day I post new information on nutrition, exercise science, and general health. I have an email portal on my Applied Metabolics website where current subscribers only can send me short questions about anything they might have read in Applied Metabolics or anything that comes to mind about nutrition and exercise, and I'll be happy to answer them. You look at that as a bonus for the subscription. I appreciate them supporting my work, and so for that reason I answer their questions. Of course, this doesn't apply if you're not a subscriber, but you're welcome to leave comments under the videos, especially if you ideas for topics for new videos. If I feel that a topic will interest a large number of people, I'll try and do a video on it. So that's about it. If you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. By the time you see this video, I will have a new dog, and I will introduce her. I already gave you a hint in my videos. So take care. Thank you for listening.